Not sure how or if you should do a breast or chest self-exam? This video will guide you through it step by step and explain why knowing your normal is so important for spotting changes early. I'm Dr. Alex Hill. I'm a board certified pelvic health, oncology, and lymphedema physical therapist. Make sure you subscribe for more videos on health and exercise routines. Over the years, there's been some debate about how useful formal breast self-exams are. Research shows that they don't always improve survival and they can sometimes lead to unnecessary tests. That's why some major health organizations no longer recommend them for people who are at average risk. Instead, experts suggest focusing on breast self-awareness. So knowing how your breasts and your chest normally feel and look so you can notice any changes early. Even without formal exams, though, many breast cancers are first found by the person themselves at home. So talk to your healthcare provider about whether breast self-exams are right for you. So how often should you check? Well, if you menstruate, the best time is a couple days after your period ends. This is going to be when breasts are less tender and swollen. If you don't menstruate, pick a consistent date each month. Many people use the first of the month, often called Feel It on the First, to help them remember. While self-exams can be a useful tool for early detection, they should not replace recommended mammograms and clinical breast exams. All right, let's jump into how to do a self-exam at home. So you're first going to stand in front of a mirror with your shoulders relaxed and your hands on your hips. You're going to look for changes in size, shape, or symmetry between the two sides. And you're also going to check for any dimpling, puckering, skin changes, redness, swelling, an inverted nipple, or any discharge coming from the nipples. You're then going to raise your arms overhead and see if anything moves differently or if there are visible changes. After you look in the mirror, then you're going to feel your breast or your chest tissue. When you're feeling the breast or the chest, you should cover the entire breast or chest and under the underarm area. You want to cover the entire breast or chest from top to bottom and from side to side, including under the arm. So you're going to lie down and using the pads of your fingers, you're going to start moving in small circles. Keep your fingers together and the pressure should be firm and smooth. You can choose your pattern whether you go in a circle from the outer edges to the middle or in rows like you're mowing the lawn, for example. So whatever your pattern, just make sure that you get the entire area, again, from basically the collarbone down to the top part of your abdomen and from your sternum or the middle of your chest all the way out to the armpit. So you're going to be checking for lumps, bumps, thickened areas, unusual textures, and any pain or discomfort that's new. Again, don't forget to check under the armpit as well. And then you're going to stand or sit and do those same motions. The skin can be easier to move when it's wet and soapy, so many people like to do this in the shower. Remember, most changes are not cancer, but it's always best to check with your healthcare provider if you do notice anything unusual. Regular self-exams help you know what's normal for your body, so any changes that occur will stand out more clearly. Thanks for watching. If you found this helpful, please give it a thumbs up, subscribe for more health tips, and share this with somebody who needs to do their own self-check.